Thanks on behalf of the Propel team for the opportunity to present some of the findings from our NIHR funded study that looked at different service models for the implementation of pelvic floor muscle training for women with prolapse. I have no conflicts to declare. We know from well-conducted trials that pelvic floor muscle training is effective for reducing symptoms of prolapse, and the recent UK NICE guidelines recommend considering supervised PFMT as a first-line treatment for women with prolapse. However, we have a problem because in trials to date, pelvic floor muscle training has been delivered by specialist physiotherapists, and in the UK there are insufficient numbers of these posts to provide treatment for the 5 to 10% of women estimated to have symptomatic prolapse. We carried out an implementation study working with the NHS providers and women with prolapse to help them identify local solutions to this problem. This was a multi-component study which involved 5 diverse UK centres. 4 centres worked with the research team to develop a model to deliver pelvic floor muscle training which suited their local context and resources. The 5th centre was a comparison centre with an established specialist women's health physiotherapy service. As part of the study, a cohort of women receiving pelvic floor muscle training for prolapse at each of the 5 centres was recruited. The prolapse symptoms were measured at baseline 6 and 12 months using the self-completed questionnaire, the Pelvic Organ Prolapse Symptom Score. We aim to recruit a total of 120 women to allow us to detect important difference in the POP-SS with 80% power at the 5% level of significance. Analysis tested the significant change in POP-SS score from baseline to follow-up for all the women, and also tested whether the change in score was similar for women treated by the specialist physiotherapists and those treated by other healthcare professionals. Service models adopted by the 4 experimental centres involved employing specialist and non-specialist physiotherapists and nurses of different grades to be involved in the delivery of pelvic floor muscle training. 3 out of the 4 centres incorporated a triage system at the initial referral to the service. More detail on the different models can be found in the realist evaluation paper published recently. Centre staff involved in the delivery of pelvic floor muscle training attended a 1-day course developed by the UK Pelvic Obstetric Gynecological Physiotherapy Network, which included practical sessions on vaginal assessment. Ultimately, 102 women were recruited to the cohort study. 91, 71 and 31 women completed the POP-SS at the 3 time points. Average age of the women was 57 and their BMI was on average 27. All women except one was Paris. So overall, how much did women's symptoms change? Well, there was a significant improvement between baseline and 6 months, as shown in the table. On average, the POP-SS score decreased by 3 points from 10 to 7. Similarly, there was a significant improvement from baseline to 12 months, although there was a reduced sample size for this analysis. We compared the improvements seen in women treated by a specialist women's health physiotherapist and those treated by other healthcare professionals. Although the improvement was greater on average for the specialist group, the difference was not statistically or clinically significant. From this cohort element of the overall study, we found that women's symptoms improved as a result of having PFMT, and the improvement observed was similar to that reported in a trial context. We didn't find a significant difference in the improvement experienced relating to who delivered the pelvic floor muscle training. Although we had difficulty recruiting to target and experienced attrition by 12 months, our sample size was still adequate to answer these key research questions. From an implementation point of view, we concluded that it's feasible to develop different models of delivering pelvic floor muscle training for the real-world settings. And within these models, there is scope for other members of the healthcare team to be trained to contribute to safe and effective pelvic floor muscle training delivery.